First, we have too little food. Eating disorders are very common among younger patients, and it is always a good idea to find out about their eating habits. Some of them live in a cereal bar and an apple all day. For others, raw carrots or fruit is their sole source of nutrition. They actually look surprised when told that this is not a balanced diet. Example, we have a female 34 years old. The patient was a company director, slim, and complained of a chronic headache for the past 5 years. The pain was in the entire forehead and came on nearly every day. Although it was somewhat better during holidays, it started in the early afternoon and increased by the evening. She vomited often which did not help the headaches. Some evenings, the headaches and vomiting were so bad that she had to retire to bed without dinner. She had noticed that if she ate something at the onset of the headache, she might be able to stop it. However, after the headache became worse, only tablets would help. So now she took a tablet every day before the headache got worse. True, it is easier to take a tablet than have a meal. I asked her about her eating habits. She had a cereal bar in the morning, a leafy salad and or apple for lunch, and a warm meal in the late evenings. She missed this meal on several occasions because of the headache and vomiting. During her midday break, she sometimes went to the company gym to do aerobic exercises. Who said that poverty is the only reason for starvation? It could be ignorance, vanity, or perhaps the fact that a doctor should prescribe food as therapy for a patient to consider taking it. I took the patient's weak pulse at her cold wrist, looked at her pale tongue, and told her that the headaches in the forehead are generally associated with the stomach. Her headache could as well be a problem of the stomach. Had she considered that she may have a low blood sugar at these times? She looked surprised, but she said that it sounded logical, especially as the headaches went away with eating. We decided that she would have many small meals during the day, but most importantly, she would start her day with a warm breakfast. As advised, I advised her to do some neck stretches during the working days in order to relax. I treated her only once. Her headache disappeared. Too little food in quantity and variety will reduce the nutrition sa blood to the spleen and stomach firstly, and then to the entire body. This leads to blood deficiency, nutritional deficiency, and loss of weight and structure, which further lead to loss of functional energy and endurance. So sa treatment, there is nothing in the world that can replace food. One could treat low appetite of malabsorption following food with acupuncture. And it is important to educate our patients about the importance of a balanced diet with regard to variety and quantity and time of day. So we have points to improve appetite, points to tonify stomach yin to work better. First, we have REN12, the mook point of the stomach, spleen 21, the major loop point of spleen, PC6, the distal point, and the stomach 43, grandmother point to tonify yin. Small and tasty meals frequently rather than large meals. Points to improve absorption of nutrition. Nausea after meals, not vomiting, is a spleen Qi deficiency symptom. So ang points, we have UB20, which is the Bakshu point, stomach 36, PC6, Spleen 6 will help along with some light moxa on run 12. Diarrhea after meals could be spleen or small intestine Qi deficiency. It depends on how soon after eating and where in the abdomen the patient feels discomfort. If the symptoms is from the small intestine, the discomfort is around the navel, and in the case of spleen, all over the abdomen. Points to improve small intestine function. First, we use UB 27, which is the back shu, stomach 39, the lower C point of small intestine 7, the lu, with some light moxa on the navel, point Ren 8.